Hello, Clarissa.
Hello.
We are now about 1 year and 4 months after your facial surgery here,
Correct.
and I have a few questions. The first one would be, why did you want to have an FS?
Well, I was rather passable. I haven't worked, but I was rather passable before the surgery. But there was still time to time these occasions that some people were considering my gender, and those few times in a year they made me really cautious about my look. So, for example, if someone was staring at me, the first idea I had was that they are considering my gender. And so I wanted to have this kind of relaxation station within myself to be in a society that and have the same feeling that I had before the transition. Yeah, of course, I had dysphoria back then, but I was also relaxed that people were not thinking what is my gender or not. So that was the reason I wanted to come.
Yeah. And why did you come to me for this surgery?
Well, I was doing a research for a long time, for 5 years, going to reviews of different doctors. I wanted to come to you because at the moment that I know, you are the only doctor who is doing only facial feminization surgery. So you have dedicated your career completely to trans women's faces. So I think that tells something, and it's not same thing than the classic other surgeries, beauty surgeries. So that was the reason I wanted to come here.
Yeah. And can you tell us something about the result? What do you think of it?
I'm very happy. I asked from you that let's not make really tremendous change, just the final touch to soften a bit my characters, and you succeeded really well. So ever since then, there hasn't been any occasions that nobody has questioned my gender or anything regarding that. So I'm very happy.
Yeah, wonderful. Can you tell us something about recovery? Did you have a lot of pain? How long did it take before you could?
Well, I have had many surgeries and big ones too. It was a bit harder than I expected actually. I was very tired for some while, so it took maybe 3-4 months to feel like energetic again completely. So you really should take a rest and wait until the scars are healing and all the swollen parts are recovering. So it wasn't really painful, but it's uncomfortable. That's the right word.
Yeah, and you told me that you also had some double vision for a long time.
Yes, I had problems with the vision. So I think it's because the swollen things go behind your eyes, and for a few months I saw everything in two because my eyes were not able to concentrate together. I think this is how it goes, and it actually took quite a long time to dissolve. It took more than half a year but it was recovering slowly. But not overnight, and that was a bit uncomfortable because sometimes I did have to cover my other eye to see what I'm reading or so. But I knew that's possible, and there is really nothing you can do for it. So.
And now it's.
Now it's good, yeah. Now it took maybe almost 1 year to heal completely. So at the end there was still like some parts of my vision I could see double, but not anymore. So that's gone now.
Happy to hear that.
Yes.
And how was your stay in the guest house?
It was very nice. I was here with my mom, and we were taking care really well both. The clinic is really modern. It's new. It's home-like. Even though it is a hospital, and it's somehow heartwarming to be in such a place which is dedicated to women like me and to take care of us. There is not many places in Earth. So yeah, it was altogether, it was really nice stay, and special thanks to Petra.
I'll tell her. If you could give yourself, as you were before the surgery, give an advice, would you have one? What would it be?
Oh yes, like I told, I have had 7 or 8 surgeries, so there is
Of
quite
the face also?
no one face surgery, but all the
Yeah,
surgeries together are
Mhm.
like 7 or 8, and I would do everything in reversed order.
Oh.
So I would start with the face and then do the rest, because that has the most biggest impact in your life in a society. I mean, everything else you can cover from your body except the face. So I would have had so much more easier years
Mhm.
behind, and less discrimination or fear of anything. So now if I would start my transition again, I would start with the face, and then approach to another. That would be a wise thing to do for your mental health.
Interesting. Last question: if someone who is interested in having surgery here in this clinic would like to contact you by email.
Yes, sure,
Yeah.
that's completely possible. I'm
Very
happy
nice
to
of you.
answer.
Okay, well, thank you for the interview.
Thank you.